In this video, we're going to talk about product selection. So first on the US market, we have 5 products. We have Botox, we have Dysport, we have Jeuveau, we have Xeomin, and we have Daxxify. So that being said, let's talk about, there's 2 main differences between these products, and backtrack for a second, they're all botulinum toxin type A. So just note that all injectable Botox or Toxin or botulinum toxin is a type A. And for that reason, we'll talk about later in complications. But the idea is that now we have 2 types of products that are on the market, ones that are going to be with proteins or animal proteins and ones without animal proteins. And this is super important because when our bodies are having a reaction or a complication or building antibodies or a resistancy, it is to those proteins. So clean products like Daxxify or Xeomin are without those proteins. So we have Botox, Dysport, Jeuveau with protein, Daxxify, Xeomin without protein, which means that your body will not be able to, or your patients will not be able to build a resistancy. And we'll go into the medical studies when we talk about complications, but for the sake of this video, we're just going to understand that there are 2 types of products. Now, when it comes to the actual product, duration and onset are a big factor. Never mind how many units is Dysport to how many, you don't have to do that much math. When we talk about how to reconstitute in a different video, we'll go over the reconstitution of Dysport and Daxxify and Xeomin, Botox, Jeuveau. So for duration and onset, that's what the main focus of why we're going to select one product over the other. So first, well, I personally prefer Xeomin, that's just a side note, because of that resistancy factor, and you're just gonna have a clean, consistent response from a patient no matter what. But back to duration and onset. Daxxify is the only one that really stands out from the rest in terms of duration because A, the onset is the same, B, the duration is that you use double the amount of products, and again, we'll talk about that in a different video, but the idea is that it's supposed to last 4 months without having much movement, and you start to see the movement at the 4 months, and you start to see significantly more movement at 6 months, and technically, according to medical studies, it can last up to 8 months before you have full movement back. So that being said, it doesn't really last double the amount of time. It just really lasts about 6 months before they have enough movement to warrant a second treatment. I have also known doctors who do boosters at the 3-month mark, and they include it in their price. So that goes back to marketing that we'll discuss in another video. But duration and onset for Botox and Xeomin are considered clinically the same. 3 to 7 days to see effect, 2 weeks to see full, peak effect, and then it lasts about 4 months with a full dose. Now, Dysport and Jeuveau both clinically say that they have a quicker onset. However, some patients or more patients have seen less duration. In other words, the onset is how quickly it takes effect, and then duration is how long you see the therapeutic effect. So that being said, it could be anywhere between 1 to 3 weeks less time for Jeuveau and Dysport than Botox or Xeomin. So while we're talking about formulations, let's talk about Daxxify. Daxxify is a little bit different because, like Xeomin, it does not need to be refrigerated when stored. Once reconstituted, like Xeomin, it should be refrigerated. But more importantly is that, again, it's a botulinum toxin type A. Like Xeomin, it is vegan. It does not have those additional proteins, so your body doesn't really, or is not able to build a resistancy. But it also has peptides, and those peptides are what's helping the botulinum toxin its effects to last slightly longer than the durations of what else is currently on the market. So it's those peptides that make it a little bit different. And those peptides, again, are plant-based peptides. It's really very uncommon. I don't think there's any medical studies of anybody having a reaction to those specific peptides, but that is the differentiating factor of Daxxify. So in terms of storing our product, and for the sake of efficacy, so in other words, things that need to maintain a certain temperature to maintain efficacy, such as Botox, Dysport, and Jeuveau, there has been 2 types of offices that I've worked at over the years. offices like my office that I'm currently in, my mixing room, which is where I prepare all of my needles and I prepare all of my syringes and mixes and everything that I'm doing, I do it in this room, and then I bring everything on a tray into my treatment room. I've also worked in and seen other offices and helped set up other offices where they felt the need to pull the vials in front of the patient to be able to show the patient, oh look, we're using specifically Botox spring, we're using specifically Dysport, we're using specifically whatever. So in situations like that, I have also found that those offices tend to have patients that come back and have a complaint saying that, well, they just didn't feel like the product was as effective. We'll talk about some aftercare instructions that need to be communicated to your patients to maintain efficacy, but we should also talk about the fact that if a product needs a specific temperature to maintain its integrity, then we need to be able to, and we're mixing in the rooms or we're pulling syringes in the rooms in front of the patients, we need to be able to maintain that temperature for that product. So what I would suggest in that case is something like this little mini fridge right here, which you can get from Walmart, you can get from Amazon, you can get from anywhere. The idea is that this little mini fridge will allow you to take the product out, use it to keep the product cold so that way you maintain its integrity while it's in the room, and then at the end of the day, take it and put it back in a regular fridge. But it's not realistic to say that you're going to have somebody or an assistant or yourself run the product back and forth to the fridge, especially if you have back-to-back clients and you don't want to forget something out and end up wasting product, or saying, well, it's only been a couple of hours, maybe I'll just use it and see what happens, and then you get either a bad review or an unhappy client and you have to redo product and waste product. So that being said, make sure that you prepare your space depending on how you want to service your patients. So just to recap, Xeomin and Daxxify can be stored at room temperature. Botox, Jeuveau, and Dysport need to be stored in a refrigerator the entire time. Once reconstituted, all of the products need to be refrigerated if it's not being actively used in a patient.